The majority of what I do at King Edward VII is facelift of various sorts. So it's very important that one combines the artistry, so to speak, which is inevitably part of this type of surgery, in a rather unique way. Combine that with the same kind of scientific analysis and rigour that you would expect if you were doing heart transplant surgery. It's very important in all forms of cosmetic surgery, but particularly facial cosmetic surgery, that when it's done, the facial features that the individual has look like they've always been that way. So if it looks as though an operation has been done, it's bad. I quite often say it's very easy to make somebody look different, but not necessarily better. Facelift is often combined with eyelid surgery, blepharoplasty, both of the top eyelids and the bottom. Sometimes brow surgery, which is done endoscopically now, endobrow, which is another operation I brought to the UK in the mid-90s. Rhinoplasty, sometimes on its own, sometimes associated with other things like facelift, sometimes with chin surgery, genioplasty. So that would be the majority of facial cosmetic surgery that I do. We do try very hard to spend time with people before operations so that they, as far as they can, understand what they might expect, and when they come into hospital, to give unrivalled nursing care for which King Edward VII has a particular reputation. And afterwards, people need a lot of emotional support often. People feel very vulnerable. They often don't want anybody to know that they've had these things done. They feel they've been as well cared for as possible, having the best combination of what would be called probably traditional English caring medicine with the very latest technology. I often see people who say, I don't know anybody who's had a facelift. I say, well, you think you don't, but you don't know you don't. Because good surgery of this sort, you can't tell.